ethical guidelines are important. We are going to learn about a model for ethical decision making. We will discuss a little about confidentiality. We have 11 principles, code principles from NADAC. We are going to go through each of the principles. For most of the principles, we'll do a case study. Using the case study, we will think about what to do, what is the best one to do. Or I remember anytime you want to, you can stop and ask questions. But I'm not following the methodology as usual because we have to do it well and we have to do it in a shorter period of time. Okay. Ethics generally means ethics as a component of moral values, meaning what is good, not so good to do. The idea of good and bad, what is safe, not safe, that needs to be kept in mind. Ethics generally refers to a code of behavior. All of us will agree to behave in a particular way. There is a code. That code is adopted by that particular group or profession or an individual. Meaning a group of psychiatrists will have a particular code of ethics for the psychiatrists. Psychologists may have their own code of ethics. This group of people in that organization will have a different code of ethics. All of us work in substance use treatment centers. The code of ethics in your organization may look different from the code of ethics in my organization. That is okay. Main thing is all of us have a code of ethics. Ethics basically means it's the standard that I maintain in my work spot. Code of ethics prescribe, tell you what I should not do or what I should do. That's what we mean when we say ethics. Generally, ethics is based on our beliefs and our values. We believe in something. We believe that humans are precious. Both Myanmar, Thailand, and India, we believe that human beings are special people and they should be treated with respect. My value systems tell me that all human beings, whether they are rich or poor, whether they are good looking or not so good looking, need to be treated with respect. So values has a part of our beliefs and our value systems. Yet in this slide, you see a new term, developmental age. What does developmental age means? Over a period of time, all of us change our beliefs. Many years ago, in most of our countries, we have somebody called slaves. They did not have any rights. They can get food only when we give food. They were treated very badly. But as civilization grew, we believe that every man has the freedom to do what he wants. So we abolished slavery. Previously, in the previous generation, we thought it is okay to beat our children, physically use a stick and beat them. It was seen as okay one or two generations before. But today, beating children is not accepted. I get very angry when children are even one hit, I get very angry. To me, beating children is not acceptable. So what I am saying is over a period of time, we change the way many years ago, our mentally ill people, we kept them chained. We tied chains and kept them. All our countries treated mentally ill people very badly. But today we understand mental illness We know how to deal with it. We treat people with respect. We are careful with them. We try to encourage them. We are looking at the positives. So, over a period of time, our values, our beliefs change. So, the code of ethics also becomes more and more different. That's all this slide says. Is there any comments you want to make? Is this clear? Is this clear? Thank you. So even if you have an excellent code of ethics in your hospital today, once in few years you should see, can we do better? Do we need to improve our code of ethics? Should we add to it? Should we become more client friendly? Should we become more, are we in touch with what research is telling us? We have to review our code of ethics at a regular interval. I am closing the first module and moving on to the second one. Okay. Second code of ethics, I only will talk about 3 slides here. I am going to do slide 7, slide 8, and then straight away I will go to slide 25. This is what I am going to do in this session. I'll do slide 7, slide 8, and then I'll go to 25. Okay. Before we start, I want to engage you into. Can you see the slide? Oh, you cannot see. Okay. Tell me, why should we have a code of ethics? Who does it benefit? It helps whom? Who gets benefited because of our code of ethics?
Clients.
Clients, very good. Because when we have a code of ethics, we make sure they get good care. We ensure that the quality of service is very good. They are protected physically, emotionally. We take good care of them. No harm will happen to them. Good. Clients benefit. For who else does it benefit? Why should we have a code of ethics? Thailand? Counselor, true. Very good. So it helps your counselor, it helps your doctor, it helps your entire treatment team. Important thing is when we have a code of ethics, we must make sure it applies to the entire treatment team, not just to the counselor. Like for example, we have code of ethics that says that the clients should be treated with respect. Is it only counselors who should respect the clients? No, the doctor should respect the client. God should respect the client. Your receptionist should respect the client. So the code of ethics makes sure that all of us are included in the code of ethics. Tell me, Mr. Fong, how does it benefit the counselor? What is the benefit for the counselor from having a code of ethics?
If he should be make from norm or so think what that he must do and protect himself.
Very good. Very good. It gives us a clear guideline of what he should do or what he should not do. Very good, Fong. So that guideline actually protects us, isn't it? Because if your supervisor asks, but Fong, why did you do that? You say that is because my code of ethics told that. It protects you. It gives a standard that all of us will do. I am your colleague. I am doing something wrong. I am assuming I'm Fong's colleague. I do something that is unethical. Fong can come to me and say, Thiru, what you're doing is not right. This is the code of ethics. Can you see this? So he is able to give me feedback so that all of us do the same things. It also is a good protection in terms of legal issues. When all of us follow the code of ethics, we make sure we are following the law. We don't do anything which is illegal. So that gives us a lot of protection. So as counselors, we protect ourselves, we protect we all do good work, and we also protect us legally. Who else does it benefit? Clients benefit, counselors benefit. Who else benefits?
Family of caregiver.
Family of client giver, okay. So clients and families benefit, okay. Who else? Pardon?
Workplace or organization.
Very good, very good. Actually, having a good code of ethics is also helps the organization. How? Why is that? Because the organization, whether it is a hospital, it is a private NGO, whatever, it protects the organization. Because since all of you follow a code of ethics, as an organization, we will do the right things. So it protects the reputation of the organization. People see you as a good organization because you are doing the correct things, right things. So it helps the organization. Who else benefits? Who else does it benefit? Who is the fourth member who benefits? Clients, family members, counselors, organization. Who else? Now, what happened to the Myanmaris? Are they talking in the slide? Oh, the whole. Very good. The entire system. Yes, Dr. Arkar. So it also helps the entire community. Because let us assume I am a counselor. I do very good ethically. I treat my substance use people. That means the quality of my work is good. When the quality of my work is good as a counselor, doctor, treatment team, my clients benefit. The problems due to substance use reduce. They feel safe coming for treatment. That means my organization is doing well. My organization is able to do quality work. Because of that, the entire community also benefits. We become a good resource in the community. A resource that reduces substance use problems, provides help for people affected so that we can become a better community. So code of ethics benefits all of us. When we do not have a code of ethics, all of us suffer. As counselors, as doctors, as organizations, clients, communities, everybody suffer. So generally what I would look at the slide on 2.7. So you must have a code of ethics. Educate all the people in your organization about the code of ethics if you have one. Make sure that people do service according to the code of ethics. Suppose your code of ethics says, do not accept gifts from clients. Don't want that. The code of ethics says that you should dress appropriately and come to work. And one of your new counselors comes wearing a spaghetti top and a mini skirt to the work spot. You should have a system by which you can call and tell her, this kind of dress code is not acceptable in our office. You can wear that and go to the party in your family. But when you're coming for class, for work, you cannot come like that. You have to make them accountable for that. When you have a code of ethics, it helps us improve our quality of practice. It helps to protect our clients. Suppose you don't have a code of ethics. What I want you to do is, I want you to list the values your organization stands for. Ask yourself what you can do. I want to fill this. Okay. List the values your organization stands for. Develop a code of ethics. Educate everybody and have a mechanism for implementation. Suppose your junior counselor tells you that the other counselor is not following the code of ethics. There should be a system by which she can complain and address the issue. If you do not have a code of ethics in your organization, please list the values, develop a code of ethics, tell everybody about it, and put a mechanism in place. Code of ethics is very important for our work spot, because especially in a substance use treatment center, because we have too many people on the staff team. We have psychologists, we have we are very diverse, in the sense too many people are part of the team. We have nurses, we have nursing aides, we have doctors, we have psychiatrists, counselors, social workers, we have peer counselors, recovering people. Too many different people are working in a substance use center. So we should have a code of ethics. Secondly, often people leave addiction treatment, staff leave. The staff turnover is very high. So unless you have a code of ethics, you can't quickly educate them and help them to follow a proper standard of behavior. You must remember that ethics is something new to the SUD field. It's only over the past 10 years that we are talking about it well. So it's something new. Most of your staff, even if they have a master's degree in psychology or social work, may not really know about ethical code of behavior. So as a treatment center, it is your responsibility to teach every staff member about ethical behavior and make sure they function according to the code of ethics. The fourth issue is, addiction is a very complex disease. So naturally, ethical issues are also very complex in our field. This is another reason why we should give a lot of emphasis to the ethics in our community, in our treatment setting. The rest of all is very similar to what I said, so I'm moving on. Any code of ethics, let me explain this. Any code of ethics takes its meaning from the values that we follow. Like suppose you want to be able to speak in Thai. You should be able to speak and read, and you should be able to read and write in the Thai language. That is the goal. You should be able to read and write in the Thai language very well. That means what all should you have? What all should you do to be able to speak and read and write in the Thai language? Tell me.
Learn Thai language and practice.
How will you learn Thai language?
From a teacher.
Teacher, and what will you do during the teaching session? Correct, Mr. Kar.
I will learn from the teacher, practice, do the exercises. Yes.
Like what? What will you, suppose you are my teacher, you are teaching me Myanmarese, Dr. Arkar. What all will you teach me?
Thai language, grammar,
You'll teach before even grammar, before even grammar.
Alphabet.
Very good. You will teach me the alphabets.
Yeah.
After you teach me the alphabets, you will teach me how to write that word. After that, before that, you will teach me the sounds. Only if I know the sounds, how to say the word. Only if I know the Thai alphabet. Only if I know how to write the alphabet. Only then I will be able to learn the language. In the same way, if somebody has to understand the code of ethics, they should understand the values behind the code of ethics. When it comes to ethics, Dr. William White listed 17 universal values. By the time we break for lunch, all of us should know all the 17 values. If you are able to do that in 1 hour, we can finish the course very easily. If you don't understand the values, we cannot teach anybody about code of ethics. Is that clear? For the next 1 hour, I don't want you to let your attention go to anything. I demand, I want, I insist that you have 100% focus over the next 1 hour. Okay? If you cannot focus over the next 1 hour, you can put your headphones on and listen to music till the end of the session, till the end of the day. Because if you don't understand values, you won't understand code of ethics. Do I have your word that you will keep your attention for the next 1 hour? Okay. Second deal is, any situation comes to your mind, I want you to ask questions. Mr. Fong, you are responsible for the Thai group. You hear somebody in your group talking in Thai, saying that is not clear, or what is that, or I don't agree with that. I want you to tell me in English, or put it in the chat box. Only if all of us discuss, ask questions, give suggestions, we can understand the 17 values well. Is that clear? Good. Okay, let's start here. I have not added any pictures, nothing I have done. Nothing is about pictures here. It is about understanding. Autonomy. Okay. Autonomy means we think the client has rights to make his own decisions regarding his life. We repeatedly ask what the client thinks about it. We want to ask the client, what is most important to you? What do you think will work best for you? These are the choices. What will the best option be for you? We repeatedly make the client feel that he is important and he should make decisions regarding his life. That is autonomy. Autonomy means the client has the freedom to make decisions about his life. Is that clear? Okay. So let's take an example. Client came to me. I see that he has had a relapse. My addiction center has inpatient detoxification. So I tell my client, okay, you've been drinking for 10 days now. You better get admitted and stay here. Stay for 3 days so that you will break out of alcohol use. Then you can go home. That is, as a counselor, I think that is best and easy for him to do. The client says, no. I'm not getting admitted. I want to stop drinking, but I don't want to get admitted. Autonomy principle says I engage in a discussion with my clients. I explain to him all the positives of inpatient detox. And then I try to understand, I listen to my client to understand why he does not want to do inpatient detoxification. The client may tell me, no, my mother is not too well. I cannot be here for 3 days. She gets very upset when I'm not there. He may tell me, no, I've decided to stop drinking. You better give me some medications. I'll take it at home, but I cannot get admitted now because I will lose my job if I take 3 days off now. He may tell me, no, I want to do it this time by myself. The client is giving me clear reasons why he does not want to be admitted. That means I have to help him see what other options are there. I may give him other ideas, eating on time, drinking a lot of liquids, getting in touch with his AA member. I may call him once a day. We will put some other system in place so that he can quit drinking without getting admitted. Is this clear? Thank you, Dr. Arkar. Thai people. Okay. Suppose there is still a problem. Suppose you know the client has been drinking for 3 months. You know that every time he stops drinking, he has withdrawal fits. You are worried whether he stops drinking suddenly, he will go into delirium. That unsupervised withdrawal may be a threat to his life. That time, can you agree with the client? Can you agree with the client and decide, okay, we will do outpatient detox? Can we do that? Can we do that or no? Give me thumbs up or thumbs down. Thumbs down. You as a professional know that it can be life-threatening. So what do? You explain to him, you explain to his family, and then you tell, I am not in agreement with you doing that because I'm concerned about your safety. If he says, no, that's what I'll do, you'll say, that is your decision, then I want you to do this. This is the card. This is the hospital very closest address of the organization, very closest to your house. You tell the family members, educate the family members what to watch out for. You explain to the client what signs he should watch out for. Tell them in case there is trouble, day or night, you can immediately go to this treatment center. You prepare the client to handle the negative effects in the best way possible. Okay? You don't tell the client, okay, you're not willing to listen to me, go away. Don't come back and talk to us anymore. Enough. You don't do that. You tell the client that this is what is best for you. You prepared a backup plan and you immediately document everything in your file. That is the best that you can do. You tried everything else, that is autonomy. So let us assume your client, he fainted and fell and is unconscious. Can you ask him, can you wait for him to give consent for treatment? We'll say, oh, your patient has not given permission for, the patient
emergency.
Is, very good, doctor. So patient is not capable of making decisions about his life. So you make it for him. That time you ignore the value of autonomy. Because life, he's not in a position to make decisions and you are making decisions for him. Is that clear? Every value like that, you should understand the meaning You should see how to apply it in clinical practice. You should also recognize situations in which you will ignore the value. You will not follow the value. You will break that value. Is that clear? Good. Good. Thank you. Second one is obedience. Obedience meaning I will obey the rules of the organization. I will obey the code of ethics of my profession as an addiction professional. I will obey the laws of my land. I am supposed to obey them. Okay, let's take an example. My boss comes and tells me, Thiru, tomorrow government people are coming for inspection. We have only 20 people in the admission. We don't tell them only 20 people are there. Huh? They will think occupancy is too less. So if they ask you, tell 30 admission. Just tell one lie. It is good for the organization. Should I obey or not obey? Remember, my boss is telling me this. Should I obey or not obey?
I think you should obey your boss.
You should not obey.
Why?
Should not obey because you should not obey because you are not being honest. That is why the third value that you see here is conscientious refusal. The second value tells you obey the rules. The third value tells you when somebody is asking you to do something which is unethical, which is wrong, you have to disobey. That is why understanding values and ethics is very important. My boss wants to tell a lie, that is his decision. But I should not do something that is unethical. Because tomorrow the boss will ask you to do something else unethical. He will tell you, this patient has stayed there for 10 days. Usually we charge 10,000 baht, but his father is very rich. It's okay. You charge 15,000 bahts. It's okay. Yeah, do you want to obey that?
No.
No. Why? That time you are refusing to obey something which is unethical. So, like suppose your rule says you must conduct group therapy for 1 hour. Okay? Huh? But your colleague tells you, Fong, let us not conduct group therapy for 1 hour. Tomorrow is Christmas. Let us all go home early. We will quietly have a discussion for 15-20 minutes, close the group and go home early. Let's both of us go and attend the Christmas party. Will you say yes or no?
No.
No, because you are refusing to obey something which is unethical. So obedience means obeying the rules of the organization. But even in the organization, they ask you to do something unethical, you as a counselor should say, no, I do not want to follow that. Does it make sense? Thai people. Thai. Thank you. So the first three is autonomy, obedience, and conscientious refusal. Now, I am going to tell you something. You tell me which of the three values is present. Okay? In my organization, the treatment plan for the client should be made within the first 10 days of admission into the treatment center. And I, as a counselor, always make sure the treatment plan is prepared, dated, signed before the end of the 10 days. Which value am I following? Autonomy, obedience, or conscientious refusal? Mr. Fong, you are muted. Unmute and tell me. Yes, Dr. Karkar, you're right. Fong, which principle am I following? Which value am I following? Obedience. Very good. Very good. Okay. Next example. The client comes in. I am a I know CBT very well, cognitive behavior therapy. I explained to him about treatment, and I explained to him that we will want you to keep diaries, record, so that you can help you understand your thoughts. This is the mode of treatment that I want to give you. The client says, I don't like keeping records, etc. Not at all. I prefer talking about it with you. And then the counselor says, okay, if you do not want to use the CBT approach, I will offer a series of individual counseling and group therapy sessions that does not need you to keep records. What principle am I following? Autonomy. Very good. Very good. Very good. Because you gave the choice to the client. Excellent. 2 out of 3 we got right. Okay. Excellent. Excellent. Very good. Very good. Okay. Then you have supervisor. Okay. Clinical supervisor calls Fong and says, Fong, I have not had any clinical supervision with you for the past 1 month. But the top boss is coming. If he asks you whether you are getting supervision, you should say, yes, yes. I am meeting my supervisor every week. What should Fong say? Fong should do what the supervisor is telling, or he should not do. Give me a decision. Ethically, what is the correct decision? Ethically, what is the correct decision?
Conscientious refusal.
Pardon? You should have conscientious refusal. Very good, very good. Remember, conscientious refusal actually protects you also. Because suppose I am your top boss. I came and ask you, Fong, are you getting supervision regularly? And Fong says yes. And then I tell Fong, show me the supervisory reports. I want to see whether the record is maintained. And then there is no sign of the supervisor anywhere. That means I will think Fong only is the bad worker, isn't it? Because Fong only told me lies. Can you understand? Conscientious refusal, by refusing to do things which are unethical, actually protects us. Is that clear? Okay. Out of 17, we have finished 3. How many more do we have left? How many more do we have left? Out of 17, 7, we have finished 3. How many 14. We have left? 14. Thai people, you don't know mathematics, huh? You know or not? We have 14 left. Okay. Now, let's go to this. I'll show you one by one. Maybe it's easier if you do that. Okay. What am I going to do? I am going to, okay. I am going to, what did I do? Fourth one is beneficence, meaning I do things which help my client. I do the right things. My intention is always to help people, help my supervisor, help my organization. So, as an addiction professional, my thought is I should help my client, help my families, and help my organization. Doing good to others, helping others is an important value. The next value is gratitude. Gratitude means passing along the good to others. Let's take an example. You came for this training program. All of you have the manual with you. After training, you should take the manual, take the knowledge which you have, and train other people in your organization. You received some knowledge, you should pass it on. That is what makes you, that's what is the value of gratitude. Suppose you go back to the organization, tell everybody, yes, international training, I have all the material, but I cannot give it to you. And you put it in your cupboard and lock it so that nobody gets this extra information. Is that correct or is it wrong? Wrong. Gratitude means you, just as how good has been done to you, you help spread the goodness to other people. Okay? So far, so clear? Okay. Competence. Competence means I must know how to do things. Or I will do things only which I am authorized to do. I won't do things which I have not been trained for. I've been a top boss in the addiction treatment center for many years. When a client is depressed and I take him to see the doctor, with my experience, I know what the doctor will give. I know he will start him on amitriptyline 75 milligrams HS. I know that. Before I reach her room, I know. If there is early morning, he may give him fluoxetine to take in the morning. I know that. Can I prescribe that to my patient? I'm not a medical doctor. Can I prescribe? No. I am a counselor. I know about medicines. I am very experienced. That is my strength. But prescribe is outside my scope of practice. It is not something that I have been trained for. It is not something in the eyes of law. It is illegal for me to write a prescription. Ethically, it is not right for me to write the prescription. That is competence. Whatever I've been trained for, whatever is my scope of practice, my area of work, only that I should do. You have some forensic psychologists here, no? Yes or no? Yes? Forensic psychologist, tomorrow you will go and do autopsy. Will you do the autopsy? No. You will wait for the physician to do that, isn't it? The doctor to do that. Just because you are a forensic specialist, you will go and do. You cannot do. That's not right. Okay? Next one, justice. Be fair. Let us take an example. Be fair meaning treat everybody equally. Suppose you have 2 hours today. and 2 clients want to see you. Okay? One is a rich, educated patient. He's very polite. He's nice to you. He says, "Thank you, madam," after you finish counseling. Nice guy. There is another patient who's poor. He's a little irritable. He's a little difficult patient. To whom should you give attention? You should give more or less or equal? You should treat both. You should give more importance to the rich guy or the poor guy, or you should treat both of them equal. Equal. Very good. You only decide based on merit. You do the right thing. You don't take sides. You don't show partiality. Are these 4 values clear? Okay. Now I'm going to give an example. You will tell me which value this shows. Okay. Now I want Thailand also to write in the chat box. I want Myanmar also to write in the chat box, so that I will know, and it will be a private chat. Okay. So, Chit, you should make it possible for them to send a private chat to me, Chit. Is it possible? Chit?
Yes.
It's possible.
Send it
They
because
can, they can choose, yes.
but I cannot see my name in the chat box. My name won't be there. Okay, just check.
Privately.
Okay, they will send.
They can send you privately.
Okay, all of you send me privately. Why I am asking that is to make sure everybody understood well. I am not going to be upset if somebody gets wrong answer. It is okay. I have made more mistakes than all of you. Every white hair that I have stands for what happened? Chat is here. Okay. Thank you, Dr. Arkar. Thank you for confirming that. I have made lot of mistakes. I am not an intelligent person. I learned by making mistakes. Okay, so don't worry if it is wrong. Just write what you think and I will explain if it is not clear. First example I am giving. I am a supervisor. Okay. And then Dr. Prapapon is asking you, supervisor, I want to send somebody in your team for training to, where shall we send? For training to Philippines. Everything free. Free flight, good stay, very good training program. You choose the counselor whom you want to send for the Philippines training. This is what your supervisor is saying. Now, you have a choice. You have 2 counselors. One counselor is very nice to you. He says, yes, ma'am, that counts. She buys gifts for you. She's very respectful. Okay? But she's not very good in her work. Frequently tries to escape the work. She doesn't give her best. There is another counselor there who works very honestly, who's very good with her clients, who shows interest in learning. She's one of your best counselors. Whom will you send for training? The first one who's very nice to you, or the second one who's very good in her work?
I think I would like to send both.
You can only send one. I'm sorry. You like to send both.
I'm sorry.
But only one seat is there.
I think the first one should practice.
I am asking you a simple question. Whom will you send for the free training to Philippines? Whom will you choose? Huh?
I'm sorry, I cannot catch you because I have a gut phone, so I'm sorry.
Okay, that's okay.
So sorry.
Prapapon.
Sorry.
One is a counselor who's very nice to you, who's very pleasant. She tells you all nice things. She says, Dr. Prabhupon, your dress is very nice. Dr. Prabhupon, you're very intelligent. She's going on praising you. She's very nice, etc. Okay? But in terms of work, she's average worker. But the second worker is very honest. Clients like her. And she likes to learn, etc. Whom will you choose? Counselor who likes you or counselor who's good in the job?
No, good in the job.
Good in the job. That means
yes.
you chose based on the merit. Isn't it?
Yeah.
Very good, Dr. Tin.
Yes, I have.
You liking the person and not liking the person is different. You must keep in terms whether they are good in their jobs or what when you decide to do something like this. So always be fair. Don't base choices based on whom you like. Do what is right, what is the correct thing to do.
Yes, we are
Okay?
facing like this one every day. Yes.
Okay. Now which value is there in this example? Which of the values? Beneficence, gratitude, justice. Very good. Justice is the value that we see here. Is that clear to everybody?
Thank you.
Justice is the value. Is it clear?
Yes.
Thailand? Yes. Good. Okay. Now let us see. I noticed when I joined the job on my very first day, my boss was very nice to me. She told me where I can have lunch. When I walked into the room, the table was cleared for me. I had a desk where I could sit and do work. She introduced me to everybody in the team, etc. She was very nice to me. Many years later, I am the big boss of the organization now. But whenever somebody new comes, even before they come, I make sure the room is clean, the table is neat, they have pens, pencils, phone is working, their reading material is ready. I give them the code of ethics, I give them the leave rules, I introduce them personally to other counselors, etc. What values am I upholding? Chat in the type box. Which value am I showing? Gratitude. It is also beneficence. Both values are seen. You understand? I want to help the newcomer on my team. So sometimes one behavior may reflect two values. Beneficence is correct, but gratitude is also correct. Why am I being grateful? Just as the way I was treated as a newcomer, I recognize newcomers are anxious and I want to give that back, make them feel comfortable in my team. So I am giving back. Gratitude is also there. Beneficence is also there. Can you understand what I'm saying?
Yes, Professor.
Yes. Dr. Arkar, what did you mean by that? I didn't understand.
We were just discussing in the chat box your case,
Okay.
the case of justice.
Yeah,
You said, we were making this. We were discussing about it, and we have some disagreements on your case.
Okay. Tell me. Tell me what is the disagreement?
Dr. Lalita thinks that the one who works well should be chosen for further higher academic training.
Yes. So one who worked well was the second one. Second one only was working well. So the answer is correct. Second one.
Dr. Lalita thinks the second one should be sent for the training for moral training and basic counseling skills training. The one who, according to Dr. Lalita, the one who works well should be chosen for further academic training, the high academic training.
Okay.
At that time, Dr. Taylor thinks that it is unfair to treat like to treat
Yes.
to treat like that.
Yes.
It should be,
I agree with you. I agree with you.
The choice of person should be random, or we should choose by making exams. Yeah, I agree with
You
Dr.
should choose.
now.
Yes. No, no. That is the second issue that Dr. Alita is coming about. She's right. We recognize, see, getting a training in international program with a high quality trainer is like a reward for good behavior, isn't it? So you send the best worker, but you recognize the first one is not good in her work, so you provide her training to improve her work performance. That way Dr. Alita is correct. Very good. That is true. That is true, Dr. Arkar. Just because a counselor is not doing well, we don't ignore her. We give her some more training to make her better. But this was an international prestigious reward. So when it's a reward, when it is a promotion, when it is an increment, then you give it to the person who deserves it the most. Am I clear, Dr. Lalita?
Dr. Thiru, may I mention a little bit?
Yes, of course.
Yes. In case of my earlier answer, I'm sorry because
no. That's okay. Yes,
I would like to mention for this one also. In our case, we have two. One is weak practice or weak task force. Another one is very good. So I think we should send two of them if we can afford, because the one who weak and the practice should learn more, should learn from their friend, their peers in the class when we have training. But another one should present her strong discipline. This is a good discipline for the counselor. That is my mention.
I understand. I thank you for telling that. You're very right. You're very right. Okay. Yes. Everybody needs training. Very good. But in the example I gave, it was almost like a reward. You understand? It's an offer of an international training. It is very prestigious to be selected from your organization to go there. Let's take this. There were about 15-20 counselors in the organization that I worked for. Okay? 15-20 organizations. When the post of the Director of Quality Assurance and Patient Care was created for the first time, my boss gave it to me, even though there were many other people with more experience, because I was known to be a very good followed the value of justice. You understand? Because it was a new position, it needed a person with motivation and understanding and skill to be able to fill that post. She didn't give that job because she likes somebody, or she's from the same religion, or from the same caste, or because somebody looks beautiful, or somebody looks somebody has a lot of money, she comes in a bigger car, etc. The choice of giving the promotion to me was based because I am an excellent worker, known for my quality of work. They were looking for a director of quality to head the Department of Quality Assurance. Naturally, they chose me. That means she is living by the value of justice. Is this clear now?
Yes, you're true. Yes.
I agree everybody needs training. But the example I gave was, Propopone is sending her abroad. It's a base, staying in a 5-star hotel. Very prestigious it is. It is where everybody is saying, good, you were selected. That means it's a reward. That kind of big things should be given to the best workers. Not because somebody is nice to you. That's all I meant. Is that clear? Are we on agreement now?
True.
Dr. Lalita, am I clear now, Dr. Lalita? Thank you, madam. Okay, now let's take another example. Okay, now this client is having a marital argument between the husband and wife. The counselor sent the doctor to the client so that the medication for disulfiram, antidepressants, etc. needs to be reviewed. Okay. So client and the wife go to see the doctor, and then the doctor gets to know that they've been having marital discussions between them. The doctor starts doing marital counseling. Doctor is doing right or wrong? Doctor is doing right or wrong? The doctor, I am the counselor. I've sent the client to the doctor for renewing his medications, and the doctor is doing marital counseling. Wrong. Why? Which value is he breaking? Which value is he breaking?
It may bias.
Competence.
Competence. He has not been trained to do marital counseling. I have been trained to do marital counseling. He may be the doctor. His area is to provide medications at the right way. But
Yes.
counseling is my area of expertise. He should not do that. He's not respecting the value of competence. Is that clear? Thailand, did you understand? See, the doctor may find out that he's having a marital problem. He may say this and that. So he listens to him for 5 minutes. Then the doctor says, I understand you're having a marital disagreement with you. I can see that. You must discuss this with a counselor. Take it up with her. Find a way to resolve your disagreement. He will go one step further, the doctor. He may pick up the intercom. Tell me, Thiru, your husband and your client and his wife are having serious marital discord. I've told them to discuss it with you. Just follow it up. He will give me information. I need to take it up, but he will not do the marital counseling. Is that clear?
เขาบอกถ้าเจอปัญหานี้หมอควรโทรไปปรึกษาดรที่ดูถ้าอาสายว่าให้ส่งไปสายการเขาเสนอให้ไปคุยปัญหานี้แต่เรื่อง medical problem เนี่ย
Good. Have you covered everything in this list? Now, how many values have you finished? How many values have you finished?
7, Professor.
7. How many do we have left?
7
10 we have left. 10 we have. Okay. Stewardship means use resources judiciously. Time, money, everything is a resource. Okay. Like as a counselor, I can't take photocopies unnecessarily. I'm wasting paper of the organization. That is wrong. The client has come for his appointment. I did not make him wait for half an hour, and I am talking over the phone with my colleague. I wasted my client's time. That means my stewardship is not good. When I leave my desk in the evening, I don't put off the fan in my room. I don't shut down the computers. I am not taking care of the resources in the correct way. I am wasting money, time, materials, etc. That is wrong. That value is called stewardship. Okay? If the client comes for one hour of group therapy, I should make sure that he gets the best possible treatment within that 1 hour. Time of the client has been used properly. That is the value of stewardship. Second one is honesty and candor, to tell the truth. I don't tell lies. I tell the truth openly. Fidelity. I don't break promises. If I tell somebody I will do it, I will do it. Okay? Don't abandon, meaning I don't let down my clients. I'll tell you an example for loyalty. Suppose I am working in this job and then I am moving to another city next month. Okay? I've got a promotion, so I'm going to another city. From Bangkok, I am going to join the organization in Chiang Mai. What do? I have to tell my patients. I have to tell them in next month, I am moving to a different job. I won't be here. But all you, there is a new counselor who is appointed who will take care of you. The name of the worker is Ta. Ta will be here in the same room. I have updated all your records. If you come in the next 2 weeks, I can introduce you to Ta also. And what do? I hand over my clients in a very proper way. That means I didn't abandon my clients. I didn't say, okay, new job, forget you, I'm going. I didn't go like that. I remember my client is a human being. The case has to be transferred very carefully. That is what loyalty means. You understand? Yes? Okay. Now, example which value, okay? My colleague often makes clients wait outside for too long. Okay? I've seen this happen repeatedly. So, I go up to my colleague and tell her, Madam, that patient has been waiting for 20 minutes to see you. It's making me uncomfortable seeing him wait. I go up and tell her, is that correct or wrong? Correct or wrong? Correct. Correct or wrong? Tell me. Thailand is still thinking. Show me a thumbs up sign. It's confusing for you? Confusing for you? Let me give you another example. I have a colleague, okay? She doesn't complete her clinical records. Today, suddenly, she took leave for 2 days. So the client comes. I want to provide service to the client. I open her records. Records are not filled. Record is not filled, so I am not able to provide the right kind of help to her client. So when she comes back after the holiday, I tell her, Madam, your clinical records are not completed on time. When you were not there, when I had to became a big problem because what should have been completed has not been done. I tell that to the counselor directly, openly, and honestly. I communicated to her that she was not completing her records, which is affecting the client. What I did is correct or wrong? Thank you, Dr. Tin. Thank you, Dr. Om. Thailand, you have to tell me an answer for this. You can't look at the computer. Fong, you have to tell me what I did is correct or wrong.
คือคนเจ้าของเคสไม่มาแล้วก็คนอื่นที่ไม่มีความสามารถมารับเคสแทนแล้วก็ไม่ได้ฟิลเรคคอร์ดแล้วก็วันรุ่งขึ้นก็มาบอกว่าคุณ
is wrong.
Wrong? It is correct what I did. Because my colleague did not fill the file. She made a mistake. She is not doing her work well. When she doesn't do her work well, clients do not get quality service. I have to speak the truth. I have to tell her it is not complete, it is affecting the client. After I tell her once, if she still continues to do bad work, it is my duty to tell my supervisor, saying many of her files are not complete. It is affecting the client care. It is my responsibility to report it. Because remember, we are all there. The person who is most important in our treatment center is the client. If the client's care is being affected, we are responsible for that. Mr. Fong, suppose I come and somebody comes and steals things from your room.
คือในด้าน stewardship เนี่ยกับคนไข้เนี่ยทำไม่ดีแต่ว่าในด้านพูดเนี่ยมันถูกถ้าสำหรับคำ stewardship เนี่ยการดูแลคือคนไข้ไม่ดีอันเนี้ยเขาเรียกแต่ถ้าเดี๋ยวหนูตอบ
Are you able to understand this or not? Why do you think it is wrong?
Professor is okay now.
It is not okay. It's something that should be done. Like, let's take an example between two doctors. Okay, let's take an example between Dr. A and Dr. B. Okay, let's take an example, imaginary example. Let's take an example, Dr. A. Okay, Dr. A is noticing, is seeing that Dr. B is prescribing some medicine in prescribing medicine that is harming the client. Should Dr. A talk to Dr. B about it or keep silent? Like, okay, Myanmar doctors tell me, I know that when I am diabetic, you can't give me some of your psychiatric medications is considered as a, you should not avoid some of the medicines, isn't it? Yes or no? If I'm a diabetic or I have a cardiac problem, you cannot take some medication, isn't it? Hello, Myanmar?
Yes, Professor, yes.
Suppose I am a doctor. I am ignored the fact, I don't even bother to ask the client about his cardiac condition, whether he has any comorbidity, and you've seen me doing repeatedly. Will you talk to me about it or not? Tell me, Thiru, this patient, I saw him the next day when you were not there. He has a cardiac condition and he is diabetic, but this medicine was prescribed. Should you give that feedback to him or stay silent?
Give back to the.
You should give him feedback, isn't it? Because what he is doing is can affect his client. Let us change the scene a little. Suppose A is seeing B and B is prescribing medicine to his brother, and that is harming the client who is A's brother. Will A talk to B? Yes. If it is your family member, you want to make sure the client is not harmed, no? You will talk to B about it, no? In the same way, every client is treated of value. If somebody is not doing their job well, we must be honest and tell him the truth. Is Thailand able to understand, or are they refusing to do that?
We understand.
Okay. Okay, I'll give you another example. I am your supervisor. Somebody else has told me that doesn't do her work well. She's constantly on the phone talking to her family members, not staying focused on her job. So 2-3 people have complained to me. So I come to your room and then say, okay, can I talk to you? I've been having some complaints about it. You and her work often together as a team. I want you to tell me whether you've seen her talk frequently over the phone. And you have seen her talk frequently over the phone. You know that other team members have watched it and they're very unhappy with what she's doing. Should you tell the supervisor the truth or tell, no, she's doing good work, madam. She's a very good counselor. Should you tell lies or should you tell the truth to the supervisor? Thailand, now tell me the answer. You should tell the truth or you should lie?
I will go and ask an investigation, ask for the reason first, and I will not listen other than I prove it the truth.
Yes, but what I'm asking you is, if the supervisor asks you, will you tell the truth or not?
Oh, we always tell the truth.
Very good. That's all. So honesty and candor means telling the truth. That's all. Is that okay? Is that okay? Suppose I told the client, I'll see you at 10 o'clock. Then I don't break the promise. I see him at 10 o'clock. Suppose that day I got delayed at home. My child was not sick. I arrived in the office just on time. And I'm feeling very tired. I just need my tea before I start talking to him. What will I tell him? I will ask sorry. That is called as restitution. I will say, I'm sorry that I was late to your session. Asking excuse when we make wrong is one value. That is restitution. Okay? Okay? Suppose I told I'll see him at 10 and I cannot make it. I say I'm sorry. You understand?
Yes.
You don't break promises. If you break promises, you say I'm sorry. Is that clear?
Yeah.
Let's go to the next one. Non-maleficence means don't hurt anybody. Don't call anybody names. Don't be rude to them. As much as possible, we don't do harm. If you cannot do good, okay.
I can see the slide.
Oh, let me see. It says I'm still sharing.
Yeah, but I can see now I can see now.
Oh, okay. I must have changed it quickly. I'm sorry, doctor. Thank you for warning me. So, even if I don't do good, remember, beneficence is doing good. Even if I don't do good, it is okay. But I should not do harm. Okay? Discretion means maintaining confidentiality. The wife told me that she's suspecting the husband is having an affair with somebody and she's crying, and I talked to her. Can I tell this to the husband as soon as he comes to the next session? Your wife is suspecting you're having an affair. Can you tell the husband that?
No.
Cannot tell. That is breach of confidentiality. Diligence means I work hard. Whatever my work is supposed to be, I work hard. I do the best I can for my client. If I spend 1 hour in counseling, I do the best during the one time for the client. I go to work at 9 o'clock. From 9 o'clock till the evening, I do the best I can for the client. That is diligence. Self-improvement means I am trying to find ways to become a better and a better person. Every time after I finish a counseling session, when I am recording, I ask myself, what could I have done better? I look for training programs to attend. I buy books to read. Even now, last month I bought a book to read. I continue to read because we have to continuously improve our knowledge. Only then we will remain as effective professionals. So we are constantly trying to improve ourselves. That is self-improvement. Is this clear? All these 4?
Yes, Professor.
Okay. Now, I already told you restitution. Restitution means saying I'm sorry. Self-interest. Self-interest is the last value. Last value because that is the most important value. That is the foundation for all these values. In your building, your foundation is below, no? Yes or no? Foundation to your building. Your Tanyarak Institute is so big, so tall. But that tall building is standing strongly because of the strong foundation. Yes or no, Thai people? Thai people. Foundation is strong, na? You know what I'm saying? Okay, you're building a house. What is the word you use in Thai for foundation? I don't know the word for foundation. Okay, there is a big tree. There is a big tree. The big tree is able to stay very strong because of its roots, isn't it? If the roots become weak, the tree will fall. If the roots stay strong, the tree will continue to grow. In the same way, only if you take care of yourself, you will be able to take care of all the other values. Last value is self-interest. Protect yourself. Take insurance, eat well, sleep well, look for opportunities, and you have to grow. Look after your family, try to become a bigger and better person, etc. These are all the 17 values. These are all the 17 values. I have 2 more minutes before lunch. Do you want to ask any? What time is lunch? Chit?
Yes,
okay.
Yes, I'm taking, please.
We have 2 minutes more, no, for lunch?
Yes, for lunch is at the 12:45 Thailand time.
What is the time now?
12 o'clock, Professor.
Chit, what is the time now?
It is 12 p.m. in Thailand.
Oh, so we have some more time for lunch, huh?
Yes, according to the agenda, yes.
Try 2 things. I'm getting confused. So tell me how many more minutes I have before lunch. How long do I have before lunch?
Actually, according to the agenda, you have 45 minutes, but I'm not sure how.
That's okay. That's okay. I just wanted to know. I'll adjust the time accordingly. Okay. Now tell me, in these 17 values, which is not clear? I put all the 17 values on the slide here. Tell me which is not clear. Which would you like me to explain again? Do you want a break otherwise? Do you want a break for 5 minutes now? Guys, do you want a break now for 5 minutes or can I continue? Yes, Dr. Tin, I saw that. I'll explain, sir. Huh?
Professor, continue.
Continue. Okay, thank you.
No break,
okay.
No break.
Okay, thank you. Thank you.
Professor.
Thank you. Okay, so let's take restitution. Oh God, what did I do? Let's do restitution. Okay, now let's talk restitution. Restitution means I say I'm sorry. Like, let's suppose, okay, I had promised to help my colleague for designing a research program. Okay, I promised to help her today for 1 hour. In the last minute came up, so I cannot see her. I am telling you, Yes, Dr. Prabhupun, you can go. Bye. I have to tell my colleague, I'm sorry. I cannot give that 1 hour to you because my client is in a crisis. I do that respectfully. Saying sorry is okay. Let us assume that I had told the client that I will give him a call today evening at 5 just to check up on him. Something crazy happened and I forgot to make the call at 5. When I call him back later, I say, I told you I will call you at 5. I'm sorry I didn't do that. It's okay to tell you're sorry. You were supposed to send a letter to the employer explaining something. The client asked you to send that letter. But in that letter, you left out, you forgot to include one important piece of information which was important for the client. The client says, oh, doctor, you did not mention that. And my boss was pretty angry with me. Then you should say, oh, that was my responsibility. I'm sorry I missed that. You make up for that. Okay? Yesterday, because of some problem, the training team could not give you information on suicide and self-care. But somehow we got together and somehow adjusted to make sure we give you that information. We made up. Okay, we didn't say, okay, that's all. Anyway, the other things, the program was okay, no? You just adjust. We didn't say that. We said we are sorry and then we try to make up for that loss. That is restitution. Is that clear, sir?
How does this different from fidelity?
Yes. Fidelity is not breaking promises. Restitution is saying sorry. Fidelity is not breaking promises. So when I promise something and it doesn't happen, I say sorry. Fidelity means as far as possible, once I give my word, I live up to it. That is why with clients, don't promise something unless you are sure you can do it. Let's take an example. I am bringing my brother to you for treatment. You are a SUD treatment center. You can tell me, Thiru, we will do the best for your brother. We will do the maximum we can to help him give up drugs and live well. That you will do. You told me you will give your best. You can try. That is good. But if you tell me, don't worry, Thiru, 100%, your brother, we will make him okay. He will definitely become substance free. Can you make that promise to me? Can you make that promise to me? I'm waiting for an answer. Can you understand? I'm asking you, what can you promise? We will do our best. Can you promise this? Or you can say, definitely 100% give up drugs. Which can you promise? The first one. So fidelity means you don't promise me this because it is not in your hand. You cannot make it happen 100%. But you can promise me this. Don't worry, Thiru. We will try our best. So if you promise this, you may have to break your promise, isn't it? So don't make promises that you cannot keep. Don't break promise. Don't make it if you cannot keep it. Once you make the promise, keep up to the promise. Can you understand fidelity now?
Yes, thank you.
Yes. Anything else?
Dr. Thiru, so
Yes, Dr. Thiru.
why I was asking about the restitution, I want to know that sometimes, not sometimes, that there is sometimes moral issue that when you are about to give a medication to one patient and you give medication wrongly, but actually, okay, let's say it doesn't affect the patient and it doesn't harm. For example, like I have to give the patient a zopiclone, which is a hypnotic agent. Instead of giving the zopiclone, I give the patient the isozopiclone. But at the end of the day, when I check the balance, I have a deficient number in the isozopiclone, so that when I check, it turned out that I give the patient not the correct one. But it doesn't matter in the sense. Should I mention, honestly to the patient and say sorry, or should I keep it silent?
If it is harming the client, then definitely it comes in conflict to the value of null maleficence, isn't it? The first principle is not to do harm. The principle of honesty and candor also comes inside. The value of beneficence, of trying to do the best for our client. This situation calls into effect many values. That is why ethical conflicts are very difficult to resolve. So in this situation, I will weigh the gains and the risks. If I give the client if I keep silent, what is the gain? What is the risk? If I call up the client and says, bring that medicine back, that medicine is not harming you, but it won't help. You have to collect a different medicine so that you will recover quickly by the next 1 week. That means you are being truthful and making sure you have done the best for the client, you've done him good and prevented harm. So far, am I clear, Dr. Tin? Okay.
Yes, thank you.
Secondly, suppose by telling him, if I tell him that it was a mistake, wrong medicine was given, you will immediately come back, even though it didn't harm you. If you tell it differently, there is a possibility that he will tell other people and the reputation of your organization is at stake. That means your loyalty to the organization also has to be taken into consideration. Your first and foremost, your one of your value is also to take care of the reputation of the organization that you work with. Once the faith in the community, in the organization goes away, it may harm your other clients. It may harm your community. And your other value is you don't want to do harm. So you think about that. So you think about gains and losses about telling him, gains and losses about not telling him the restitution, and then make your decision. You may decide that you will call up and said, we gave you a different medicine. Actually, it is milder. Doctor wants you to try a better one. You please come back and we'll issue a different drug. That way you have taken care of beneficence. You've taken care of what? Taken care of non-maleficence. You also taken care of loyalty. Can you understand, sir? You want to do the best for your client. If it means that you have to do it without restitution, I will let go of restitution, but I will do what is good for the client. Am I clear, Dr. Tin?
Yes, thank you. Thank you, Dr.
And also you must remember, Dr. Tin, any value implementation depends upon our cultural setting. You understand? It also depends on our cultural values.
Yes, yes.
Okay? So you must also be very wary of that. Like in my community, touching other person's feet is a sign of respect. Okay? But generally, we never touch the feet of somebody who is younger. That is considered wrong. I cannot touch the feet of somebody who is younger than me. If I touch it, it will hurt them a great deal. You understand? So I should not touch the feet of a youngster. He'll get very upset. It seems as if it's nothing big, but it is a very big thing for us. So the values are very important. The cultural values are important. Remember that. Yes, go ahead. Anything else? Any other clarification? Any other value? Okay, let's check if you understood this well. Okay, I will tell you the description. You choose the quality. Is that okay? Huh? We do not want on any account to do harm to our clients. It is in this column. Choose. I do not want to harm my client. Non-manifestance. Very good. I continuously try to become a better professional by going for training.
Self-improvement.
Very good. Self-improvement. I tell the truth. Very good. Honesty and candor. Very good. If somebody asks me to do something wrong, I refuse to do that.
Conscientious refusal.
Very good. Conscientious refusal. I have some rules in my organization. Everybody has to follow it. Whether it is a highly educated, very rich, or my illiterate carpenter who's being provided free treatment. Same rule for everybody. Which value is that?
Yes.
Justice. See, when you think of justice, you think about the weighing scale, no? You say it is equal, no? So that is justice. Do you understand all of this in this column? Okay. Now I'm going to ask you a meaning for this column. Saying sorry and making up for mistakes which are done. What is that?
Restitution.
Restitution. Very good. I always believe in helping my client make decisions regarding themselves. I recognize his right and his ability to make decisions regarding his life. Client has power to make decisions. Which value is that?
Autonomy.
Autonomy. Very good. Autonomy. Very good. I believe client has a right. I follow all the rules in my organization. Obedience. Very good. I don't waste time in my room looking at my Facebook and watching Netflix. When I'm in the office, I do only office work. What is that?
Diligence.
Diligence. It's also stewardship, isn't it? I use my time well. Sometimes the values are, in some issues, they will overlap. Two values may be there. That is okay. Okay, now we come to the second column. Everywhere I go, I speak for my organization. I go to a meeting, somebody is saying some grants are available. Me find out whether my organization can get the money so that my organization we can improve its services. What is that? Loyalty. Very good. Very good, guys. I'm very thrilled. Very good. Okay. I have been offered a new job. It is going to increase my salary. That new job is closer to my house. I think I'll be happier in that job. So I have decided to take that promotion. Which value is that?
Self-interest.
Very good. Self-interest. But at the same time, I take the job which is in my self-interest. But before I take the job, I am still loyal to my clients. So I give them advance notice. I hand over my clients to the next counselor. I do that and then I join my new job. I tell my new boss, I'm happy to work for you, but I need 1 month time to wind up, hand over my clients meaningfully. I cannot abandon my clients. I tell them and do that. So that is loyalty. Okay. My college, which taught me social work or forensic psychology, whatever, they're calling me and asking you, hey, Jay, can you come and speak to our students for 1 hour on substance use impact? We can't give you money for that. We can only pay for the travel. Can you come and give this 1 hour lecture free of cost? And then you say yes. Which value are you upholding?
Gratitude.
Gratitude. You're giving back. You got something from them and you're giving back to the society. That is giving back. You always want to do what is best for your client. What is that? Doing the best for your very good, very good. Beneficence. Your client is overweight. Client is overweight. You are a psychologist. So you sit with her and tell her, draw up a diet chart for her and tell her how many minutes of walking she should do in a day. You tell up, give a series of exercises and then you tell her you start doing jogging from tomorrow itself, every day in the morning. Which value are you going against? Which value are you breaking? Competence. You are not a nutritionist. You are not a personal trainer. Your area is psychology. So if I'm overweight and I need nutritional advice or I need a personal trainer, you should refer me to somebody else. But you should not do that. Suppose I go jogging tomorrow for half an hour when I have not got clearance from my doctor and I start panting and jing and then I rush to the emergency. Who's responsible? You are responsible. You ask me to do something without having the qualifications to do it. You may harm me. That is okay. Good, guys. You now have a very good idea of how to do that. Now you give me somebody here give us a situation. All of us will guess whether it is right or wrong. I'm sorry, you give an example. We will identify the value. Anybody can give a situation. I want it to go alternately. 1 Thai, 1 Myanmarese. 1 Thai, 1 Myanmarese. Like that.
One situation that I want to ask Dr. Tilo that we found a situation that when we have the problem with the ANC clinic, that means antenatal care clinic, and then you find that the lady, that the pregnant woman got positive of HIV test, and what will you tell the husband?
Okay. So she's saying the client has come to the antenatal clinic. Wife has SUD problems. Should you immediately call the husband and let him know or not? Which value comes in the place? Yes, everybody guess. Madam has given a good example. Very nice situation, madam. Tell me, what all values come into play in this situation?
Discretion.
Client is pregnant. Very good. Discretion. I'm going to highlight this so that all of us are clear. So this brings into the point of view of discretion, because you have to maintain client confidentiality. What else comes into question? What other values are come into play? What play? Beneficence comes into play. You want to do the best for the client. You also want to do what is best for the unborn child. You are responsible for the well-being of the child. The unborn child is also a citizen of Thailand. That child cannot advocate for its rights. So you have to speak on behalf of that child. The mother continues to use substances, it will harm the child. And your duty is to protect the child also. It also brings into the point of view of autonomy. The decision to use drugs or not, you have to involve the client. It is the client's life, it is the client's child. So you have to ask yourself how you can work around this. Yes? Yes or no? So, in this question, we have to explain to the mother that it is harming the child and substance use has to be addressed. If, of course, she is a heroin user, you may shift her to methadone or buprenorphine. But otherwise, if she's drinking alcohol, you have to do detox in a safe manner or help her stop the use of alcohol completely. Because even small quantities of alcohol will affect the unborn child. And you have to protect the unborn child.
Dr. Chiru, how about the obedience?
Wait, one more thing. Let me finish. Confidentiality can be broken in 2 times. You have a duty to protect. The duty to protect is more important than the duty of confidentiality. You have a duty to protect. So you are going to tell her that alcohol use is going to harm your child. It's important you stop. If you do not stop because you are harming the child, I may have to inform authorities and other people to prevent you from harming your child. Somewhere we have to keep this in mind. So what do? We want to help the client. So we talk to her nicely. We understand the difficulty. We present the options. Help her make a decision, a way out of the situation that is suitable to her. But she has to stop using alcohol completely. There is no change about that goal because you want to protect the child. But we do it in a way, the choice, the approach, we give her a choice. Okay?
I think the question is whether to inform about her serology status to her husband or not.
That's what I'm saying. You have to do. First, you don't immediately go and inform the husband. That is breach of. What do you think will happen? See, remember, now this woman is taking drugs. Okay? Let's take this. Huh? This lady is taking drugs. Okay? Main issue is her taking drugs. You want her to stop taking the drug. Isn't that your goal? Isn't that your goal? You want to stop her from taking the drug, isn't it? Yes or no? The best chance of her, of making her stop taking drugs is in the therapy that she receives from you. This is the best option. So you want her to take therapy and stop drugs. That means you try to talk to her, encourage her, explain to her, give support, tell her please take help, etc. If she refuses, then you are going to tell her, now I am going to break confidentiality because ethically it is not possible for me to allow you to harm your child. That is only the next step. First, I try to get her cooperation to stop using and protect the child. Okay? You cannot automatically break confidentiality and inform the husband. You also remember that many countries, many organizations have laws regarding confidentiality. Check your local laws. Check the laws of your country. In some countries, when she aborts a child, the signature of the husband is necessary. Without that, you cannot carry out an abortion. That means you respect that law. Your country may have a law that the husband should be immediately notified. If that is the law in your country, meaning it is a legal law, you have to obey that. If there is a rule in the ANC clinic that if you find substance use in the serology test, you should immediately inform the OB/GYN. You must follow the rules of your agency. If that is there, that takes precedence over everything else. Can you understand?
Yes.
Ethical decisions are not so easy. You have to think from different angles. That is why we need an ethical decision making model. Is that clear? Can you see a simple question? So many values, so many contrary views. We have to weigh the gains and losses and then come to a decision. Suppose you minute you see the wife is taking drugs, you call and tell the husband. The husband will come, beat her up, tell her how dare you take drugs when you are drinking alcohol when you are pregnant, and then he will probably divorce her, throw her out of the house. But she is not going to get any therapy. She's not going to stop using alcohol. She'll continue to use alcohol. Child will continue to be affected. What did you achieve? Nothing. So you have to take action. But there is a way in which you take action to minimize the harm and increase the good. That is what ethical decision making helps us to do. Is that clear? Yes, I have an okay from Myanmar side. What do the Thais feel about that? Madam, you asked the question. Are you happy with what we are suggesting, madam? Madam, Thai madam.
Okay. Yes, okay.
We talked about many values that is involved in this. Are you happy with this or not happy with this?
Very happy.
Yeah, thank you, madam. Okay, now, since we finished this, I want to do one quick thing. There is always an interface between ethics and law. Remember this rule. If there is a conflict between the ethics and the law, law always takes precedence. I am running a treatment center. The police have come. They have an arrest warrant with him. And they say, we know the client is inside your hospital. We have to take him into custody because we are investigating a murder. You have to allow us to enter the hospital and take charge of the patient. Patient is not in any medically risky condition. Patient is medically okay. He's just going through psychological therapy. Should I think, oh, getting arrested will hurt and upset my patient, so he may have a relapse. So should I protect my client or should I follow the law? Tell me, what should I do? Make a choice, guys. Choose. Should I allow the police to come inside and execute the arrest warrant, or should I tell lies and say, no, patient is not here, and send them away?
I think we should obey the law.
We should obey the law. The law of the land takes precedence. So of course, as a counselor, I want to do best for my client. So I may talk to the arresting officer, explain that he has just been treated for SUD, and we are trying to make the best so that he doesn't relapse. We tell him that this are the medications we are giving him. Even if he's in arrest, we want to make sure the medicines are given. And if he's going to be held in the local jail, can we send somebody to help motivate him to stay safe? And as soon as he's discharged, can you make sure he comes back to complete treatment? All this I will discuss with the arresting officer and try to do the best for my client. That I will do, but I will still respect the law of the land. Is that clear? Sarkar, that's Thailand. Oh, very good. Good. Now, let's see. There are some decisions which are both ethical and legal. Okay? Legally, only a doctor can prescribe medication. If I don't have a medical degree, I cannot prescribe medication. Ethically also, as a psychologist, I cannot prescribe medication. So that is something that is both ethical and legal. Okay? It is something that can be considered legal, but it is that can be considered ethical, but illegal. What can ethical and illegal be? Okay, like let's say many countries have a law. I don't know about Thailand and Myanmar. I'm just giving an example. In many countries, engaging in a homosexual relationship is illegal. Okay, I'm talking to my client. I can see my client tells me that he wants to engage only in homosexual relationships, and he is in a steady relationship with another man, and he talks about it, and he says I had an argument with my partner, and he talks about it, and I give him help to deal with that, and how he can make up with his homosexual partner and make up and make the relationship better. What I'm doing is very ethical, isn't it? Ethically, what I'm doing to help my client is right. In the eyes of law, it may be illegal. Can you understand?
Yes.
That relationship is considered illegal, but I am helping you do that. This is an example for ethical and illegal. Okay? In some countries, many years ago, they had a law. If the client was HIV, if you know the client is HIV positive, you are supposed to immediately inform the health authorities. But it was a very unjust law, because what they did, they announced to everybody that this guy is HIV positive on their website. They gave them a lot of trouble. Many counselors thought that what they were doing is unethical. So what did they tell? They told the guys, see, it is very important for you to do HIV testing. But by law, if you come and tell me the result, I have to inform the authorities. So you don't tell. If you tell the result, that is a risk. But even if you are positive or negative, we will discuss how you can live with your positive status and with your negative status. We can discuss the issues. But if you tell me openly that minute that you are positive, I have to inform them. So what did the clients do? They got information about HIV. They knew how to go to the next neighboring country and get their HIV test without breaching confidentiality. They got information about how to handle the HIV positive status. At the same time, the counselor did not breach it. So she behaved very ethically, and she also did not break the law. Can you understand? She managed to give help to the client without getting into trouble with the law. Is that clear?
Yeah.
Okay. Sometimes there is no law. No law, and I just accept it. Like, let's say, going for trainings and upgrading my knowledge. That is ethically, as a counselor, I am supposed to do. Is there a law that says counselors should go for regular training? Is there a law? No law. Does the law says no, Thirumagal, don't go for training? No. It is neither illegal or illegal. No law, but it is ethical for me to go for training. Let's take another thing. Unethical and legal. Some things can be considered unethical but legal. That is, client says, I cannot pay for treatment. This is all the money I have. I can discharge the client. I can say legally I should pay the bill. He's not willing to pay the bill means I don't want to treat him. I can discharge him. That is legal, but it is unethical. Ethically, I should at least 2 more sessions. I should provide the client free of cost. Find an alternate source where he can continue treatment without on a free of cost basis. So I have to find a backup plan for him. Just because he cannot pay for my services, I cannot abandon my client. That is unethical. But legally, it is okay for me to say you no money, no service. I can say that is legal, but unethical. Is it clear? Yeah. Okay. Let's take something unethical and illegal. If the clients in the addiction center don't listen to them, you can beat them up, lock them up. That is unethical and illegal, isn't it? Ethically also it's not correct. Legally also it's not correct. But many addiction centers in many developing countries, still there is a lot of physical abuse going on in our addiction treatment centers. Very sad, but it happens. Okay. Then there are some things that unethical, but the law is silent on it. Like suppose my client says, oh, I'm so grateful to you. Because of you, our family is so happy. I want you to give you a diamond set jewelry. And he gives it to me. And I accept it. It is unethical. Am I prohibited by the law from accepting this expensive gift? Does the law say anything? No. Law is not saying anything. But to me, it is unethical. Is that okay? Now you give me an example. Forget this. This is a very dicey issue. Let's let go of this. I'm taking this away. Tell me something that is legal and ethical. Tell me some example which is legal and unethical. So give me some example. Let's see where it fits. Give me some example.
Unethical and illegal criminal abortion, maybe.
I didn't understand, sir. Give me the example, sir.
Give me the example, sir. Unethical and illegal.
Anything, any of it. Legal and ethical. Either of the four. Okay,
Criminal abortion, maybe.
Okay, give me the situation.
Criminal abortion without any reason.
Huh?
Criminal abortion without any reason.
Oh, okay. Let's see. Okay, let's take this example. Generally, you don't do abortion after she has completed 12 weeks, isn't it? 12 weeks of pregnancy. After that, you don't do because it is very risky for the mother. Yes or no? Can you understand?
Yeah, in Myanmar, we don't allow any form of abortion.
Oh, in Myanmar, no abortion. Okay.
Yeah. He's trying to say illegal and unethical.
Yes.
Is the criminal abortion. The example is the criminal abortion.
Okay. So, abortion in Myanmar is illegal and he also considers it unethical. Okay? That's what you are saying.
Yes.
No?
Yeah.
Okay. It is considered illegal and unethical. Okay. This is Myanmar stand. Okay. In India, we allow abortion. we believe that it is the right of the mother to decide whether she wants to carry the child or not. We believe that if the mother is not able to provide for the child will be born. The child won't have enough food, won't have a shelter, won't have care. The child may be abandoned. The child may suffer too much. So, if you ask somebody, if you ask a OBYGN in India, she will say the mother has a right about deciding whether she wants to bear the child or not, because it is her child. So, abortion, she will say, is both ethical and legal. So that's why I'm saying ethics and law depends a lot about the country. Personally speaking, I would not do abortion. I believe that life is precious. That is my personal opinion. Okay? I had one, if I had become pregnant even after 1 year after my first son was born, I would have continued with the pregnancy. I would not have aborted the child, because that is my personal opinion. My personal opinion is different from what I will do with my clients. But when I sit in the counseling center and the client says, my husband is so abusive, I don't see how I can survive. Every day I shiver when he comes. I've decided to abort the child because I want to be the best mother I can be. And in this condition, I'm not able to do that. I will not fight against it, because that is her decision. So the situation is very different between Myanmar and India because of our own laws, our own cultural way of seeing things. Okay. Give me another example. Good one, sir. Thank you for bringing up that culturally, nationally, we may have different values. Very good.
Yes, Dr. Thiru, may I present a case?
Yes, doctor.
So normally we have a certain regulation about the sterilization for the woman. Sterilization means that the not to have any.
Yes, I understand. So decision not to have any more children. Yes.
So then what happened is after 3 deliveries, after 3 pregnancy, at the time of the 3rd pregnancy, the woman may apply for the sterilization permit. And when at the time of the delivery, she can undergo the sterilization operation. So what happened is the woman has a heart disease, and she is in her 2nd pregnancy. She applied for the sterilization permission, but the board has not yet approved. She went into emergency labor and operate the cesarean section on her. At the time of that cesarean section, the doctor noticed that she cannot withstand the, so he decided to do the sterilization procedure. So in this situation, professionally it is right, but she hasn't, her case hasn't been approved. So it is still illegal.
Yeah. See, in this kind of questions only as a doctor, any law usually says unless it becomes a threat to life. Hello, have I lost you? Hi guys, can you hear me?
No, we can hear you.
Okay. That's why the law is not, law often, sometimes we have to do advocacy with the law. We have to present the case, we have to argue the case, etc. There are many cases that like this, where we have to argue for a stand up against a unjust law. Like generally speaking, a doctor will never conduct the delivery of his wife, isn't it? You won't conduct delivery on your wife, isn't it? You'll send him to say, you'll refer your wife to another obstetrician to conduct the delivery. Yes or no?
Yes, unless it is an emergency.
One of the finest doctors I know works in a tea estate. Tea estates are really inside. There's a long road with which you can reach any major hospital. He was a pediatrician. The wife went into labor. He knew that unless something is done immediately, the wife will die. He handled the delivery at home. He took a risk because anyway, The wife's life was at risk. So immediate attention, the risk of him doing it immediately outweighed the risks of waiting. So these are ethically complicated situations. I'm happy you brought this up, Dr. Twin. That is why the conflict between ethics and law is not so very easy to come up with. Sometimes we have to become advocates. We have to argue for what is right, because you did it in the best interest of the client, and life is the most important value that we have. Even HIV. Initially, when HIV came, we said before the woman is tested, anybody is tested, she has to give permission. Without her permission, to test for HIV was considered unethical and illegal. But later, as the decision grew, CDC came up with a clear understanding. It says the client came to you for treatment. As a medical provider, you have every right to do anything that is best to provide the good medical care for him. And you have a right to prescribe a HIV test and get it done. So the entire scene changed after that. So this struggle between ethics and law has been there for a long time, and we have to struggle with it. We have to fight for unjust laws and changes. That is why the first slide which I showed you, ethics has something called a developmental age. With time, things change. Like in my country, even if when my son was in college, once a semester the Catholic college will send for me, and the mark sheet will be given to the students in the presence of the parent. That is India. In America, even in parents don't have a right to know the child's marks in school unless the child shows it to them. Their law is different. Our cultural situation is different. So these kinds of differences will come. That is why any ethical decisions need to be carefully considered. Is that okay? There are no easy answers. No easy right or wrong. Yes. Yes, if it is emergency, it is lawful. Yes, Dr. Ong. Yes, I agree. Okay. Sit, how many minutes do we have for lunch?
Actually, we already have at time for lunch.
Okay.
Yes.
From now, we give them 1 hour for lunch. We don't eat into lunchtime. So I will take note of my time now. I will sign in after 1 hour. Thank you for your patience. And we will finish the principles soon during the afternoon course. Goodbye. Thank you. See you after 1 hour. Bye-bye.